My name is Dr. Hazel Kariuki. I am a consultant physician and internist and head of Department of Internal Medicine at the Naivasha County Referral Hospital based in Nakuru County in Kenya. I also work part-time as an associate at a specialist cardiovascular practice based at the Nairobi Hospital in Nairobi, Kenya. I have been sponsored by the Merck Foundation to pursue the postgraduate diploma in Preventative Cardiovascular Medicine from the University of South Wales. I started my program in August of 2019. So the prevalence of heart conditions has been rising in Kenya. This trend has been seen all over Africa and the developing world. At present, just to give an example, the prevalence of hypertension is anywhere between 12.6 to 36.9, depending on what part of Kenya you're in. We tend to see higher prevalences in urban centers, and this is driven predominantly by the aging population, the use of alcohol, cigarette smoking, obesity, and increasing socioeconomic status of most Kenyans. I felt blessed and humbled. I did not take it for granted that I was one of 6 Kenyans who were chosen to begin this program. It felt like a burden to begin with, to be honest, because we felt that the mantle of the whole country rested on our shoulders. But with the guidance of the Merck Foundation, we were able to overcome that obstacle, and we were able to overcome it successfully. So the postgraduate diploma in Preventative Cardiovascular Medicine gave me a firm grounding in research techniques. It also introduced me to studies and the wide field of literature on cardiovascular disease. And this literature was up to date, very current literature, most of which I was not well acquainted with. How that helped me in my practice is that it helped me be on trend with everything that has just come out in the literature and be able to apply it in my context, both in the rural urban hospital that I work in and in the urban center in Nairobi. So having completed the postgraduate diploma in cardiovascular medicine, I had been selected as a head of a committee for the Kenya National Cardiovascular Guidelines 2022 edition. And I was the chairperson of the VTE, which is the Venous Thromboembolism Committee, and also participated actively on the dyslipidemia committee. And this is a big impact on my career because as a young physician, it gave me a voice and a forum to sit among my peers, my teachers, and be able to share ideas and current literature that had just accrued from my program, and be able to actually guide a group of 6 clinicians who are far more experienced than me and far more educated than me. It was a humbling experience, and it was all made possible by this opportunity. So this 12-month course is vital to my practice in the rural urban center because the government is beginning to roll out a digital platform which is supposed to cater for patients with both diabetes and hypertension. This platform is revolutionary in Kenya. There has been no such platform. And the emphasis of this platform is to be able to connect doctors working in rural urban health facilities with patients at the grassroots, to be able to ensure continuity of care, to be able to follow up complications of patients, to ensure that patients get the medication at the right doses, and to be able to call patients back for review as it is required. I anticipate that this will dramatically reduce the rate of complications that we see arising from cardiovascular disease, such as cerebrovascular diseases and strokes, heart failure, ischemic heart disease, peripheral vascular disease, among others. Because if we are able to follow up Kenyans' hypertension and ensure that it is well controlled, then we will be able to reduce the incidence of these cardiovascular diseases and ensure the health of the whole Kenyan population. And so why this is very important to me is because Kenya's goal in our health sector is to ensure equitable, affordable, and affordable healthcare for all Kenyans, which is their right under the Constitution of Kenya. It was a rigorous course. And quite challenging, but at the same time, very enjoyable because you're learning new concepts at a very rapid rate. But at the same time, you're doing that in a group of your own peers. And so you're able to discuss topics and able to approach the tutor for an overriding opinion on a discussion point that is difficult for all the participants. And so I found that the course took a big chunk of my time. I will not lie about that. But looking back, I would not have had better use of my time if I hadn't done that course. And so I'm very appreciative to the Merck Foundation for having given me this challenge and having helped me overcome it successfully. And I would wholeheartedly recommend it to my colleagues and have done so. And I've had 2 of my colleagues join on my recommendation. I have received an invitation from the non-communicable disease desk, that is Dr. Nasi Rombi and her team, and the Kenya Cardiac Society under Dr. Lilian Bao, and the current and the past chairperson, which was Dr. Bernard Gitura, to head the Venous Thromboembolism Committee for the revised 2022 Kenya National Cardiovascular Disease Guidelines, and was also participated in the Dyslipidemia Committee. So this I found was a great acknowledgement from the Ministry of Health and a testimonial that the graduates of this course shall be making an impact both locally and nationally. Currently at the Naivasha County Referral Hospital, we have managed to get patients from a wide catchment area including Nakuru, from surrounding counties like Narok and Nyandarua, and those patients have sworn that they have not received such services in a government facility since the inception of these facilities in their respective counties. And we have begun to have an enormous following in the medical outpatient clinic, to the extent that we are now having to expand the clinic to 7 days a week rather than the 1 day a week that was there previously, in order to cater for the numbers that we are now attracting because of the quality of service that's being offered. And I attribute this in part, obviously, to the training that I received under the auspices of the Merck Foundation from the University of South Wales. So I'd like to take this opportunity to thank the CEO of Merck Foundation, Dr. Rasha Kilech. You're making a difference to lives, madam. You may not know us, but this is one of the faces that you've made a difference to. I get to impact many lives on a day-to-day basis. And in that regard, I see you as a hero. I want to thank you from the bottom of my heart. God bless you.